There are health conversations that feel uncomfortable to start. The ones that touch on something serious, something that rarely announces itself loudly, something that tends to arrive quietly and be recognized far too late. Pancreatic cancer is one of those conversations. And if you have ever thought, I will look that up when something feels off, I want to gently suggest that the time to learn what off looks like is now, before it does. I am Dr. Naira Stein. For many years, I have worked alongside older adults navigating complex health decisions, and one of the things I hear most often from people affected by pancreatic cancer, either personally or through someone they love, is that the signs were there. They were simply not recognized for what they were. Today, I want to change that, at least for you. Stay with me. What follows is not meant to frighten you. It is meant to equip you with specific, accurate, clearly explained information that belongs in every older adult's working knowledge of their own body. Why this particular cancer deserves your attention. The pancreas is a small, tucked-away organ that most people never think about until something goes wrong with it. It sits deep in the abdomen, behind the stomach, and it performs two essential jobs. It produces the enzymes your body needs to digest food, and it manufactures the hormones, including insulin, that regulate your blood sugar. Because it sits where it does, surrounded by other structures and largely inaccessible to routine physical examination, problems within it tend to develop in silence. Pancreatic cancer has a 5-year survival rate of roughly 12%. That figure reflects a hard reality. By the time most people are diagnosed, the disease has already advanced significantly. It is not that the warning signs are absent. It is that they are often attributed to other, more ordinary causes. Aging, stress, diet, the kinds of general complaints that get noted and quietly set aside. Understanding 8 specific signs, what they are, why they occur, and when they cross from ordinary to worth investigating, is the most meaningful form of early awareness most people will ever have access to. Sign 1. A change in the color of your urine. One of the earlier signs that something may be interfering with the function of the pancreas is a change in urine color that persists even when you are drinking sufficient water. When a tumor in or near the pancreas places pressure on the bile duct, the channel that carries bile from the liver into the digestive system, bile cannot drain as it should. A compound called bilirubin, which is produced during the normal breakdown of red blood cells and would ordinarily leave the body through stool, accumulates instead in the bloodstream and finds its way out through the urine. The result is urine that is darker than usual, a deep amber, a brownish tone, something resembling strong tea or dark cola, rather than the pale straw color that indicates healthy hydration. This change is worth paying attention to, specifically because it tends to appear before the more visible signs of jaundice, yellowing of the skin, and whites of the eyes, that most people associate with liver or bile duct problems. If a darker urine color persists for more than several days and cannot be explained by dehydration or a recent change in diet, it warrants a conversation with a doctor. Sign 2. Pain in the upper abdomen that reaches into the back. The pancreas occupies a location that puts it in close proximity to a dense network of nerve tissue. When a tumor grows within the organ, that proximity becomes significant. Pressure on the surrounding nerve structures produces a distinctive and often persistent form of discomfort, a dull, deep ache in the upper abdomen that tends to radiate into the middle or lower back, sometimes as a band of pressure across the torso. What sets this pain apart from ordinary digestive discomfort is its relationship to position and meals. It often worsens after eating, and many people find it more pronounced when lying flat. Sitting forward or leaning slightly reduces it, which is a pattern people sometimes discover by instinct without knowing why it works. Initially, this discomfort may come and go. Over time, as the disease develops, it tends to become more continuous and more difficult to ignore. A persistent, deep abdominal or back pain that does not resolve on its own and follows this kind of pattern is something to discuss with a physician, not dismiss as a muscle strain or digestive inconvenience. Sign 3. Persistent bloating and early fullness after eating. Feeling full very quickly, after only a small amount of food, or experiencing persistent bloating that does not respond to the kinds of things that ordinarily help with digestive discomfort, is another sign that the gastrointestinal system may be under pressure from outside its normal boundaries. A tumor growing in or near the pancreas can press on the stomach or the upper portion of the small intestine, physically limiting the space available for food and disrupting the normal process of digestion. Because the pancreas also produces the enzymes that break food down, a tumor that interferes with enzyme production adds a functional disruption on top of the mechanical one. The result is a bloating that feels different from ordinary post-meal fullness, not temporary, not easily relieved, and often present even when little has been eaten. If this pattern persists for weeks without a clear explanation, it belongs in a medical consultation. Sign 4. Enlargement of the gallbladder or liver. When the bile duct becomes obstructed, as it often does when pancreatic cancer develops in the head of the pancreas, the region closest to that duct, the bile that cannot drain must go somewhere. The gallbladder, which ordinarily stores bile between meals and releases it as needed, fills beyond its normal capacity. The liver, which produces bile continuously, begins to accumulate what it cannot move forward. The gallbladder, in this condition, can become noticeably enlarged, large enough in some cases to be felt during a physical examination as a firm fullness beneath the right side of the rib cage. The liver may develop a similar tender enlargement. These are findings that a physician examining the abdomen may detect, and that imaging studies, ultrasound, CT scan, will typically reveal clearly. This is one reason why a thorough abdominal examination remains relevant even in patients whose symptoms seem primarily digestive. The cascade from one blocked structure to the next is a reliable and early biological signal. Sign 5. Unexplained blood clots. This is the sign that most people find genuinely surprising when they first hear it, because the connection between the pancreas and the blood's clotting behavior is not intuitively obvious. Pancreatic cancer releases inflammatory compounds into the circulation that alter the balance of the body's clotting system, creating a state in which the blood becomes more prone than normal to forming clots, particularly in the deep veins of the legs. Deep vein thrombosis, clotting within the large veins of the calf or thigh, may present as swelling, warmth, redness, and pain in the affected leg. This on its own requires medical attention. The more urgent concern arises if part of that clot detaches and travels to the lungs. Sudden shortness of breath, chest pain that worsens with a deep breath, and a rapid heart rate are signs of pulmonary embolism and require emergency care. An unexplained blood clot in an older adult with no obvious risk factors, no recent surgery, no prolonged immobility, is something physicians are trained to investigate for underlying causes. Pancreatic cancer is one of them. Sign 6. Recurrent fever and chills without a clear infection. Pancreatic cancer can trigger the immune system into a sustained inflammatory response that produces temperature instability, episodes of chills and shivering that shift to fever, sometimes accompanied by night sweats and a general sense of unwellness that fluctuates rather than resolves. This differs from the pattern of an ordinary infection, which typically follows a more predictable course and improves within a week or two. Fever related to pancreatic inflammation tends to recur, to be accompanied by the effects of bile duct obstruction described earlier, and to be resistant to the kinds of treatments that work for ordinary illness. For older adults who experience episodes of unexplained fever and chills, particularly when those episodes are accompanied by any of the other signs described here, the pattern deserves medical investigation rather than a waiting approach. Sign 7. Fatigue that does not respond to rest. There is a quality of fatigue specific to serious underlying illness that is categorically different from tiredness caused by poor sleep, overexertion, or a busy week. People who have experienced it describe it as a heaviness that sleep does not touch, waking after 8 hours feeling no different than before lying down, finding that activities which required no real effort before now require deliberate recovery time. Climbing a flight of stairs feels like a significant task. Concentration becomes difficult. The emotional texture of this kind of fatigue often includes a low mood or a sense of withdrawal that is not characteristic of the person's normal temperament. Cancer-related fatigue of this kind arises because the disease places metabolic demands on the body that compete directly with normal energy production. Cancer consumes resources. The immune system's sustained response to the disease consumes more. Normal cellular maintenance begins to lose priority. This form of exhaustion, particularly when it develops gradually over weeks without a clear explanation and does not improve with reasonable rest, is worth investigating as a symptom rather than accepting as an inevitable feature of aging. Sign 8. Changes in digestion and stool appearance. Because the pancreas is the primary source of the digestive enzymes that break down fats, proteins, and carbohydrates, Any condition that impairs its function has direct and visible consequences for digestion. Food may sit unprocessed for longer than normal, contributing to nausea, bloating, and a reduced appetite. Unintended weight loss often follows because the body is not effectively absorbing the nutrients in the food being eaten. The most specific digestive change, and one that many people find embarrassing to mention, but that carries real diagnostic significance, is a change in stool character. When fat cannot be properly broken down and absorbed, it passes through the digestive system largely intact. Stools become pale or greasy, float more than usual, and have an unusually strong odor. This is not a hygiene issue. It is a physiological signal that fat digestion has been disrupted, and in the absence of any other obvious explanation, it points toward the source of that disruption. Pale, greasy, foul-smelling stools that persist for more than a few weeks are something to bring to a doctor's attention specifically and without embarrassment. None of the 8 signs described today is a diagnosis. Each one, taken alone, may have an ordinary and benign explanation. What matters, and what I hope you carry away from this conversation, is the pattern. Several of these signs appearing together, or any one of them persisting without resolution, is information your body is offering you. The question is whether you receive it in time to act on it. Pancreatic cancer is difficult to treat, partly because it is rarely caught early. The window in which early detection makes a genuine difference in outcome is real, but it requires people to recognize these signs, to take them seriously, and to bring them to a physician who can investigate properly. That process begins not in a clinic, but in a kitchen, or a bathroom, or a quiet moment of noticing that something does not feel the way it usually feels. Your body has been communicating with you your entire life. At this stage, it deserves the most attentive listening you can give it. I am Dr. Naira Stein. Every conversation like this one is rooted in a belief I have held throughout my career. That information, clearly given and honestly delivered, is one of the most protective things one person can offer another. If this has given you something useful, a sign to watch for, a conversation to have with your doctor, a reason to take a symptom more seriously than you might have, please share it with someone who might benefit from the same awareness. Take good care of yourself. I will see you in the next one.